One of the things we deal with all the time is athletes coming in who cannot produce true hip extension without excessively extending their lower back. We talk about the anterior pelvic tilt quite frequently, and we just see this over and over and over again. When they begin to put force down into the ground, when they begin to attempt to access that lower posterior chain, the spine initiates with hip extension, there's a rib flare, and we get a lot of compression in the lower back, and then we get an excessive anterior pelvic tilt even beyond what they're already dealing with. Here's a couple exercises to restore hip extension without excessively compensating through the lower back. To begin, we need to think about hip dissociation, lower back flexion, unload that lower back, as well as significant end range hip extension in the presence of an active glute and hamstring. So just go into half kneeling. I've got a rolled up towel here. What I want to do is compress my rib cage, restoring that ability to not live in the context of an anterior pelvic tilt and a rib flare. We're going to compress the rib cage against the thigh and use breath work to unload the lower back and the hips. So get in that half kneeling position, rolled up towel, put that right up against the rib cage, get all the way down as deep as you can, knee as far forward as you can. Now that you're all the way down here, go ahead and in this case on my right leg, I'm going to extend that knee as far as I can up toward the ceiling. Now I've got that glute and hamstring extension. I'm compressed in the rib cage on the left side. I'm going to take a moment here. Let's just do 4 breaths in through the nose, out through the mouth. Long, slow, silent inhale through the nose. Exhale through the mouth. Sigh that air out. See if you can find a little bit of oblique. Do that 4 more times. You'll repeat that on the other side and do 2 sets. Okay, now that we have some hip dissociation, we've used our breath to open up the lower back and loosen up the hips, we're going to now use a foam roll. And I also want you to make sure that you keep that rolled up towel handy. We're going to put that underneath the neck. It's going to open up our airway and allow us to continue to work on our diaphragmatic breath as we work on hip extension in the presence of a more neutral and unloaded lower back. So get that foam roll. Make sure that the neck is fully supported, not under the head, but the neck is fully supported. Put the heel on the foam roll. We're going to flex the opposite leg as far to the chest as we can. Now go ahead and take a long, slow, silent inhale. Exhale and push through that heel forcefully and get as much hip extension as you can. And so you'll see in this position, with this knee fully flexed, the lower back is going to be unloaded and in a more neutral position, even as we're really dialing in hip extension through the hamstrings, through the glutes on the opposite side. So you can do 7 of those on each side, 2 sets. And then next week, we'll go ahead and take a look at how to advance these exercises. All right, I hope that was helpful. I look forward to seeing you here again next week.